An abdominal aortic aneurysm is an enlargement of the lower portion of the body's main blood supply, aorta. From the heart, the aorta travels through the middle of the chest and belly. Since the aorta is the body's major blood vessel, a ruptured abdominal aortic aneurysm can result in potentially fatal bleeding. Treatment options range from watchful waiting to urgent surgery, depending on the aneurysm's size and rate of growth. Symptoms: it can be challenging to diagnose abdominal aortic aneurysms because they frequently develop slowly and without obvious symptoms. Some aneurysms do not burst. Many people start tiny and don't grow. Others expand over time, occasionally quickly. You might notice the following if you have an expanding abdominal aortic aneurysm: continual, severe pain in the side or area of the belly, abdomen, backache, the abdomen's nearby pulse. Causes: although aneurysms can form anywhere along the aorta, most aortic aneurysms develop in the portion of the aorta that runs through the abdomen. An abdominal aortic aneurysm can form due to a number of factors, such as arteries become harder, atherosclerosis, when fat and other materials accumulate on the walls of a blood artery, atherosclerosis results. Elevated blood pressure: the walls of the aorta can be harmed and weakened by high blood pressure. Vascular illnesses: these conditions result in the inflammation of blood vessels. An aortic infection: rarely, an abdominal aortic aneurysm may result from a bacterial or fungal infection. Trauma: an abdominal aortic aneurysm, for instance, might result from vehicle accident injuries. Risk factors for abdominal aortic aneurysms include using tobacco. The biggest risk factor for aortic aneurysms is smoking. Smoking can weaken the aorta's walls, which raises the possibility of developing and rupturing an aortic aneurysm. The likelihood of getting an aortic aneurysm increases with how much and for how long you smoke or chew tobacco. In order to check for an abdominal aortic aneurysm in males aged 65 to 75 who are currently or previously smoked cigarettes, doctors advise a single abdomen ultrasound. Age: the majority of abdominal aortic aneurysms affect adults 65 and older. Being a man, abdominal aortic aneurysms affect men far more frequently than they do women. To be white. White people are more likely to have abdominal aortic aneurysms. Family background: the likelihood of developing the disorder is increased in families with a history of abdominal aortic aneurysms. Different aneurysms: an abdominal aortic aneurysm may be more likely in people who have aneurysms in other big blood vessels, such as the aorta in the chest or the artery behind the knee. Thoracic aortic aneurysm: your doctor could suggest further precautions if you have compromised arteries and are at risk of developing an aortic aneurysm, such as blood pressure drugs. Complications: the main problems include ruptured aneurysms or tears in one or more layers of the aorta's wall, aortic dissection. A rupture may result in internal bleeding that is fatal. In general, the risk of rupture increases as aneurysm size and growth rate increase. The following are symptoms and warning signs of an aortic aneurysm rupture: back or stomach pain that comes on suddenly, lasts for a long time, and feels like it's tearing people apart. Reduced blood pressure, rapid heartbeat. Blood clots in the area are also more likely to form in people with aortic aneurysms. It may hurt or prevent blood flow to the legs, toes, kidneys, or abdominal organs if a blood clot that was lodged inside the inner wall of an aneurysm escapes and obstructs a blood vessel somewhere else in the body. Prevention: do the following to stop an aortic aneurysm from developing or from getting worse. Avoid using tobacco products or smoking. Avoid second-hand smoke by giving up smoking and chewing tobacco. Consult your doctor about possible treatments and medications if you need assistance quitting. Adopt a balanced diet. Eat a range of fruits and vegetables, whole grains, chicken, fish, and low-fat dairy products as your main food sources. Limit sodium and stay away from saturated and trans fats. Keep your cholesterol and blood pressure under control. Follow the directions on any prescription drugs that your doctor has given you. Exercise frequently. Get 150 minutes or more of moderate aerobic exercise each week. Start softly and build up if you haven't been active. Consult your doctor about the appropriate activities for you.
For any questions, leave a comment below and don't forget to subscribe.